Good afternoon, viewers. Thank you for joining this latest episode of HBMA Live. Today we have two guests from CAQH CORE. We have Bob Bowman and Erin Weber, both of whom are co-directors of CAQH CORE. Bob and Erin, welcome. How are you doing?
Doing great.
Doing great.
Thanks.
Yeah.
Thanks for having us today.
Well, thanks for being our guest. We appreciate this. So this gives our viewers an opportunity to learn more about activities and initiatives within CAQH CORE, as well as give a little bit of a preview for your presentation at the HBMA conference this year, which will be held in Dallas next month. But before we get into the formal sort of business discussion, I'd like to have our viewers just get to know both of you as well. Healthcare transactions are pretty technical. It's a pretty specialized area of work. So how did you both get involved in this area, this field? Or how did you come to join CAQH?
Sure, I can start. After grad school, I moved to the DC area and started working at the advisory board company, which provides best practices research to hospitals and health systems across the country. And I first heard of CAQH there actually from Anish Chopra, who was ultimately the chief technology officer for the United States. But at the time, he also worked at advisory board. And we profiled some of the work that CAQH was doing to our members around creating utilities for the industry to help reduce burden, particularly for providers. So many of you may know of our ProView product around credentialing and provider data. And so that was where I first heard of CAQH. After that, I moved on to consulting, where we were helping different health systems update their revenue cycle systems. And there was some overlap there as well when we started looking at some of the data needs and looking at what was actually in the eligibility transaction, for example. And so I ended up participating in a CAQH work group while I was consulting, and ultimately was contacted, by a recruiter and had a lot of familiarity with CAQH. And what I really love about CAQH CORE in particular and the work that we do is, we're not just solving a challenge for a single client. We're really thinking about how can we create industry level change and industry level cost savings that will work across not just kind of a one-time solution for a single issue. And so I find that really exciting and motivating.
Yeah, and I guess similar to Erin, coming up out of school, I worked in a number of different places, but usually all around provider and provider data and technology. Started out working for a large vendor for Medicaids and connecting providers to the Medicaid systems for claim submission, for provider enrollment into those systems. And then moved over to Humana, a large national health plan, as many of you know, and was their EDI manager. So really deep diving into the technical analytical ability and technical aspects of claim submission, attachment submission, eligibility, provider prior authorizations, really working with the technology behind how providers interface with health plans. And then also kind of like Erin, also recruited from Humana to work at CAQH because of the technical skills that are required to understand, again, as Erin mentioned, those different stakeholder perspectives. So you have a health plan, a provider, those vendors and clearinghouses that often help bridge the gap of the technology and the data, and making sure that we all can kind of come together to the round table. Everyone has a stake in the game, and really driving those efficiencies through consensus, right? What's the best approach to move forward? Where can we all go? It's not just the low-hanging fruit. It really is making strides to better adapt the technology to the needs of providers, and plans are really willing and able to do that. So really getting them on board to do that in a really thoughtful way, right? As we plot that out.
Right, that's an idea about bringing the providers together and getting them to work on a solution together. They all have their own sort of systems, their own proprietary systems. How has that been working with them? It's always, it can be difficult when you've got industries that are so sort of segmented and you've got individual companies with their own systems. Has that been a challenge bringing them on board? And obviously they're involved in CAQH CORE.
Yeah, actually, again, that's one of the things I really enjoy about working at CAQH is that we are and particularly within CORE, we have about 120 organizations that participate with us, including health plans that represent about 75% of covered lives across the United States.
Wow.
In our work groups and in our subgroups, you have all of these different representatives from provider, health plan, vendor, clearinghouses, associations, other standards organizations coming together to debate and discuss potential operating rule requirements. And, not everyone agrees all the time, but we really try to move forward with a consensus process. One of the stories I like to tell around the value of the work that we do was when we were developing rules for EFT and ERA. On the call, and this was several years ago, providers were saying that they weren't getting the reassociation data they needed to bring those two transactions back together. The data was just not on the EFTs, the reassociation number they needed. And we had plans on the phone that were saying, well, geez, we're sending that number. We don't know why you're not getting it. We're putting it in the transaction. And it turned out that we also had the financial services industry participating in that rule development, because obviously the EFT transactions were flowing through the banks. There was no requirement that the banks kept that number in the transaction and passed it on to the providers. And so once the banks spoke up, it became very obvious, why that number wasn't getting to providers. But if we not had all of the stakeholders together, we wouldn't have been able to identify that challenge. So we ended up putting some operating rules together that actually required the health plan to inform the provider that they needed to request that information from the bank, and then for the provider to do that. So it's been a really kind of interesting collaborative experience. And I think people really come to the table with the healthcare industry at large in mind, and not necessarily what's best for their individual organizations, which really helps us move forward.
I think that's great. It's a testimonial to the power of associations and organizations like HBMA or like CAQH. That's so much what it's about, is just convening the discussions, and then sometimes the solutions come out of it. Sometimes they don't, but at least you can identify problems you need to address.
Yeah, I think that brings to mind another really important concept that we drive here too. Not only consensus for operating rules that can be really technical, and we need this data to be in this spot in this transaction, and those really detailed conversations, but we also identify needs of the industry and then can launch education efforts and initiatives too. We'll publish white papers, we'll host webinars, we will bring the industry together just for that reason, right? Just to bring more awareness to some of the challenges. And that, again, spurs more conversation. We also develop not just white papers and thought pieces, but we also develop really sophisticated, frequently asked questions that we publish free on our website. It really bridges the gap between different associations like NACHA for the EFT transaction, but also X12 and HL7, some of the more technical organizations that are developing standards. And ourselves, we bring all this information together, publish those FAQs out on our website to really help drive people to the right pieces of data, the right type of business operation that they might want to put in place to kind of resolve. The data is coming, but how do you make sure it gets down to the right person in the back office to just know that it's available where it's available at, and then how to actually operationalize that data into a real world scenario that you need to actually resolve that data component.
So for our viewers who aren't as familiar with CAQH, can you just share a little bit about the history? When was it formed? How was it formed? And, from your opinions, I know, what do you think are some of the biggest wins over the years? Ways in which it's made some really practical, created some practical standards that really solved a critical problem for the industry, healthcare or medical billing or both.
Yeah, I'll give a little bit of the history, and then maybe Bob can talk about some of the wins. CAQH as an organization was founded. We just celebrated our 20th anniversary last year. Founded by a group of health plans who felt like there were some administrative processes that if they collaborated and worked together and did it through a single, single place, that they would both reduce their own costs and resources and create efficiencies for providers as well. So as I mentioned, that first kind of flagship product was our ProView for provider credentialing. So it allowed
I know, Erin, you're breaking up a little bit.
Okay. I'll let Bob jump in then.
You
Yeah,
call it
definitely.
yep.
The collaborative approach that we initiated back in 2000 and 20 years ago really helped lead us to some key successes. Something that we take really for granted right now is deductibles, co-pays, co-insurance. Those things were not required to be returned by a health plan, and oftentimes they weren't. You would only get a yes/no indicator for an eligibility transaction. Yes, this member has coverage. Or brought our stakeholders together, and we required that data to be returned by health plans. And all of the core entities, the health plans that participated, voluntarily changed their systems to return a deductible, a copay, co-insurance amounts. They did that on a volunteer basis. And it became so ubiquitous because you had the big plans kind of adopt it first, right? Everyone else followed suit. And it became such a required need of providers to collect a copay that now we don't even think about that today. But that is an initiative that CORE started 20 years ago. And we really look for those types of administrative wins for providers. Where can the data come from? Because the health plan probably has it somewhere in their systems. If the provider needs it to make an interaction between a member or a patient more efficient, then how can we get access to that data, bring it from those back-end systems that the plans have? The provider can actually actualize that with a member and make that a streamlined service. So we've done it for eligibility, great example for copays and deductibles. Forward with the reassociation data so that providers and back office staff can actually look at an EFT transaction and a remittance advice transaction and pull them together and actually post that to their AR systems. We're doing the same thing now with prior authorizations. You often have to have proof of medical necessity. So you have to have attachments submitted with the prior authorization. Well, it's such a bifurcated process today for many providers that it's slow, is really inefficient. So we're building operating rules around attachments and the prior authorization transaction to actually bring them two transactions together, to be submitted at the same time, and the response can be remitted back to the provider in kind of in real time. There's no reason why it can't be, right? So how can we make sure that those back-end systems can be mitigated and changed and updated to ensure that the provider has the information they need when the member's in the office? So we're continuing that work on every other administrative transaction.
That's encouraging to hear. One of the first issues that I heard about when I joined HBMA a few years ago was just at the pain point of attachments. And I'm glad to hear that progress is being made in that. It seems that CAQH and CORE, sort of really focus on some real pain points, not just for insurance companies, but also for providers in the revenue cycle management industry at this time. So that's one that I think would be a big accomplishment if that's something that can be resolved in the near future.
Yeah, and we've actually have just initiated and launched our prior authorization. Our attachments work for claims. So we kind of wrapped up our project for prior authorization, and now we're working on attachments for claims. We understand that there could be different data needs, both from the health plan's perspective and also what's available at the provider office when it comes, because there are different use cases, right? PA and claims. So having those discussions and identifying the variability between the transactions and those data needs, and also, right, there's different vendors and clearinghouses and software available for the users of those transactions. And then again, what transaction to use? Is it a PDF? Is it a fax machine? Is it file? Is it an X12 transaction? All of those points are on our agenda to discuss and work through and build consensus around an approach that the industry can adopt.
And of course, we're also hopeful that the challenges with prior auth will be resolved too. And so, no pressure on that one either. We know that's an enormous issue for providers, for insurance companies, for patients, and everyone in between. Yeah. And when you're coming out to meet with us and present in Dallas, you're going to be talking about interoperability rules. So, we talked about prior authorization and, of course, attachments. Are there other areas that you want to sort of get into in that presentation? Again, not without revealing too many details, but just to give our viewers a little bit of a sense of what you're going to be covering.
Yeah, there's definitely lots of moving parts within the industry, and we try to, because we have such a large participation group that we work with 120 participants, really kind of have a lot of stake in the game when it comes to where's the industry going to go next, right? We project out where we're going to be in 3 years or 5 years or even 7 or 10, because technology changes, data needs change, regulation comes along down the pike, and we have to be able to respond and react to that as well. So as things move forward, we're trying to always stay a little bit ahead of the game. So we bring in the big brains into our organization through our participants, and they help us drive towards what's going to come next. So we looked at prior authorization and attachments, and now we're looking at claims and attachments. We're going to be looking at the advanced EOB. There's requirements and lots of talk in the industry about how do we ensure that there's no surprise billing, right? Conversation around that. So obviously, if a provider needs data from a health plan, that's our sweet spot. We know how to do and develop operating rules around that, and we can help inform health plans can provide that data and how providers can access or request that data. So if it is an advanced EOB, or how do we ensure that the member has this benefit coverage, and what is going to be the deductible it's going to hit, and what is the impact on payment, those are the discussions that we'd like to have. So we're going to be hosting conversations later this fall or later this summer and into the fall just around that. So it's a great timing with your conference. We're going to bring those types of conversation components to our agenda, and hopefully get some good information from HBA membership there too, because we can bring that back to our work groups as we develop those types of talking points, our agenda, and potentially solutions, right? That's our goal, is to provide solutions for the industry for those data needs.
Right. Well, it's good to hear that you're thinking about the whole issue of surprise billing too. I'm sure you're aware of the No Surprises Act, which is now has regulations that the industry is going to have to comply with. So it sounds like you're looking at those requirements as within CAQH.
Yeah, and if you can hear me again. Yes. Good. We are launching, in particularly looking at the advanced explanation of benefit requirements in the No Surprises Act. We're launching an advisory group on August 19th, actually, to start thinking through what are the potential standards and requirements that might be needed. First, looking at the provider to payer exchange, that sending of the good faith estimate of charges. Because we've heard a lot of discussion in the industry around, wanting to use the existing claim transaction, others wanting to move to FHIR. So trying to find a recommendation that will work both in sort of the short term, because I know a lot of organizations are worried about the January 1, 2022 date, but also trying to think longer term around how can we make this something that's meaningful for the patient and not just a box we're checking for compliance. So that group will be working through that. Our goal is to put out a sort of guidance document with recommendations for just that particular component of the use case at the end of September. So we're trying to turn around some recommendations. We don't have time to develop operating rules and put them through our whole rule development and vetting process, but these are things that could be turned into operating rules over the longer term.
Well, that's a pretty quick time frame, though, for you.
Yeah. Yes, I think everyone's feeling the pressure from this one.
Absolutely. We've seen the stories in the news. Of course, we saw the action taken by Congress, and these regulations are coming fast, and the implementation date is really not that far off. So. And
it'll be really important to get feedback from organizations that are within the HBMA membership in particular, because you all have a very different perspective and understand the unique needs, particularly of the smaller provider offices, and that's really helpful for us.
You're right. That's something that is interesting about HBMA is we do represent such a diverse membership. From individual proprietorships, to companies that are sort of small to mid-sized, to some very large companies. So you'll get a really diverse perspective from HBMA. For your presentation, and I don't want to, again, reveal too much. So are you thinking that it'll be more interactive, or is it more really sort of lecture style with sort of one-way communication?
We definitely like it interactive. So we plan on having some polling questions and maybe even some breakout session kind of things to get some really thoughts and feedback on, like you said, that diversity of membership is really important. So the smaller, medium, and large. Again, you might have different needs. You might have different perspectives. You might have different systems and applications that you use, right? So those types of software limitations, that's also important too for us to understand. So we really like the interactive give and take. So we'll ask a lot of polling questions. We'll ask some feedback. We'll have a large Q&A session so we can get that feedback and bring it back in-house as we continue our discussions through the rest of the fall.
That's great. Gives you the opportunity and our members the opportunity to provide that feedback as well.
Yep, for sure. So come with your questions and come with your feedback.
I'm sure they will. They're listening now, and if they're not tuned in now, we'll certainly make sure they're aware of this and the opportunity to provide that feedback. So
perfect.
And Erin, you talked about CAQH really being forward-looking too, sort of trying to plan for the future. So we know what the next year or so is, but are either of you willing to sort of share what you see longer term happening within healthcare, within revenue cycle management, or within claims processing?
I can share a little bit, and then Bob, feel free to follow up. I think one of the things our board in particular is looking at is the role of more standard agnostic operating roles. So we're seeing the shift within the industry to greater use of APIs and FHIR, and interest in using that for revenue cycle. I think some organizations are ready to go and hit the gas on that, and others, haven't even thought about it yet. So we've been having a lot of conversations around how can we help industry make this shift while maintaining interoperability across organizations that are different stages of their technology adoption spectrum. So that's something we've been looking at. The data within the transaction needs to be consistent regardless of the standard being used. And so how can we make that happen and enable progress across the industry using operating roles?
And maybe to jump in and maybe see how this sandwiches together, that our very first transaction that we started with was the eligibility transaction. And over time, 20 years later, here we are, and we understand from providers that there's still challenges with that transaction. They may use the transaction, get the information back, and then still have to pick up the phone to validate very specific benefits because benefit structures have become more complex. So has value-based payments. How does that impact the nature of the work that a provider or a billing office does? It does impact it. So we're looking at the eligibility transaction again and seeing how we can advance the data needs that the providers have into the current transaction. There's lots of things that impact that, like tiered benefits, right? Tiered benefits have become more and more ubiquitous and more complex and harder for providers to understand and collect the appropriate dollar amounts, right? And then bill them correctly and that kind of thing. So we're looking at that transaction again. We'll be going through next year to see what other kinds of benefits. We know like telemedicine has been a big topic this year. There's impacts to the eligibility transaction for telemedicine as well. So those types of topics have come up from our membership over the course of this year, and we'll be wrapping those into our work through next year as well.
Great. We appreciate that, and we appreciate the opportunity to hear from you today, hear about the presentation. I don't know if there are any questions or comments from our audience, but this has been helpful for me, and of course I appreciate the invitation actually to engage, HBMA being engaged in CAQH CORE and contributing to your efforts. So that's something we'll certainly discuss with an HBMA. And I know it's been a little while, a number of years since we've really been active, so I'd like to bring us back in. I think there's a lot of areas where we can provide important input.
Definitely. We definitely appreciate it too.
Do you have any parting thoughts? We really appreciate you taking the time to be a guest and chat with me today.
Just a big thank you for the opportunity, Kurt, as always. HBMA has been a long time member and supporter of what we do. We have had a great collaborative relationship. We want to make sure that we can continue to serve your members and the providers that your members serve. And we really want to continue that relationship. So we look forward to that moving forward through next year.
Well said. And I guess I'll say ditto on my side for HBMA. Bob, Erin, thank you so much for being a guest. And everyone, next week we'll be broadcasting live from the CAQH Success Summit, actually at 5 p.m. Eastern, so it's a slightly different time, and hope to see you all then. Take care, everybody. Be well. Be healthy.
Great.
Thank you.
Thank you.